Welcome, everyone. It's great to have you all here. So, we have a panel that we put together of people who work with students who do counseling services for college students. So, it's just an opportunity to provide some information and also for you as guests to ask any questions that you have to these current providers. So I'll get started. My name is Jody Tang, and I'm an associate professor in the counselor education program at North Dakota State University. I also provide counseling to clients or students on campus, very, very minimal. I only see probably about four people a week, maybe. So a minimal amount, but I do that just to keep my foot in the door, keep counseling people. And the others that I asked to be a part of this panel also provide counseling to college counseling students, or at least have in the past. So I will just turn it over to them to introduce themselves. The first person that I see is Riley. So I will actually turn it over to you first to introduce yourself and just kind of say in what capacity you work with students.
Again, my name's Riley. I'm a master's student here at NDSU in their counselor education program. I'm an intern over at NDSU's Counseling Center, and then I'm also the clinic manager over at NDSU Community Counseling Services. I see just college students over at the Counseling Center, and then I just work as a manager in that capacity here at CCS, where we take in community members as well as like college age folks or overflow from the university.
Thanks, Riley. I think the next person I see is Maddie.
My name is Maddie. I am a current doctoral student at NDSU in the Counselor Education and Supervision program. I did my internship at M State back in 2020. Wait, it was 2020 to 2021. How can I forget that year? So I worked with college students in that setting. M State has a little bit different clientele than being a tech school than some of the four-year universities, so students of all ages. Not that we don't see that at other universities too, but now I'm at Concordia College, and it's definitely more so what you would consider like the typical college students. So working with students primarily age 18 to 22, right in that new young adult stage, and I've been here for a little over a year.
Thanks, Maddie. And then the next I have Bill.
Hello, everyone. My name is Bill Burns. I'm the director of the Counseling Center here at NDSU. This is my 17th year here as director. Prior to that, I was director at a small private liberal arts college in New York called St. Lawrence University for 7 years. And so I do the administrative side of things at the Counseling Center, but I also see students. I probably see 10 to 15 students a week.
Thanks, Bill. And then Austin.
Hello, my name is Austin Williams. I am a doctoral student in the counselor ed program at NDSU. I'm also an international student from India, and currently I am an LEPC counselor in North Dakota. I have worked with college students in M State and at NDSU. Primarily some of the work that at NDSU that I do is with Riley at the Community Counseling Services. I am relatively new to the counseling space since I've been seeing student clients since 2021. However, being a student is not relatively new to me, and I've been a student since 2015 and gone through it. So I have a lot to draw from my personal student experience and apply it to the work I do with college students.
Thank you, Austin. And last but not least, you have Marcia.
Hi, my name is Marcia. I am also in the doctoral program at NDSU for counseling, education, and supervision. I currently work in a private practice in Moorhead, but I have 5 years experience working at the counseling center at MSU, and I worked with all students there, worked closely with the COC in the master's program, doing referrals back and forth from their space also. I still get referrals for a lot of college students in my new job too.
That's great. Thank you so much for your introductions, everyone. So the way that this is set up is really a panel. So anybody who is participating, you're free to ask any questions of the panel members, being obviously mindful of confidentiality of students and so forth. But if the conversation lulls, I also have a number of questions that I can use to ask them. But I will turn it over to audience members. If anybody has a burning question that you want to start with or anything on your mind, feel free to start us up. I'll get started with the first question. But so one of the things I think, people might want to know, or people might be questioning, especially if you're a faculty member or work with students, but not in maybe a counseling capacity. But for panel members, what do you think are some of the major issues that you see college counseling students struggling with today?
Well, I can jump in because we keep track of this stuff for the counseling center. So over the years, I think that the most common things that we see are anxiety and depression, anxiety by far being the most common. After that, it would be things like relationship issues, academic concerns, family of origin concerns, substance use concerns. But anxiety and depression and relationship and academics kind of top the list. Since the pandemic, I know nationwide we've seen three things grow: social anxiety, relationships with family within family of origin deteriorating, and loneliness. Those numbers have gone up around the country since the pandemic.
That's something that comes up a lot in our work and just our discussion too about noticing those patterns with the social anxiety, loneliness especially. And I was recently listening to a podcast and I forget which one, but kind of talking about the influence of social media and that as well. Because I think something that we really grapple with or think through is like, okay, are people more connected than they used to be, right? Because you can text anyone you want at any single minute, and at the same time they're not engaging maybe face to face as much as you would expect. And so looking at that kind of paradox of like you've never been more connected and still loneliness is a chief complaint or one of the chief complaints. So it's just been really interesting to think about, and how do we mitigate some of that too. So if anyone has an answer, that'd be lovely.
Thanks for sharing that point, Maddie. I actually noticed that trend, or I guess that theme, pop up in some of the sessions or the clients that I worked with, is that sense of loneliness or isolation with social media. And I guess the romanticizing of having a lot of friends or a lot of people knowing about you or knowing you has led to, it's like quantity of friends versus quality of friends. And in college spaces, which are supposed to be these social settings where you build quality interactions, quality connections, and really get to know people, a lot of students avoid getting deeper or going deeper with connections. And I feel with the pandemic, which was again like another whole year of forced isolation or just staying isolated, it prevented them from cultivating skills or developing skills that would allow them to go deeper with relationships or bonds. So it's like a lot of people know a lot of people, but it's hard for them to figure out or point out how many people am I truly close with? How many people can I really rely on or talk to important things without being judged, without having my own anxiety being riled up of, oh, am I being a burden to this person or not?
Which is, it's kind of interesting that you all talk about that, which it sort of leads a little bit into my next question. But I'm curious, to those of you who've worked in this for a while, and I know you kind of all have a range of experiences, but do you feel like, I mean, many of you mentioned COVID. Do you feel like college students' mental health has changed significantly over time? I'm seeing you nod, Austin, or just, yeah, what's your understanding of that? Or I don't know, what do you make of that?
For sure. And I think Maddie can jump in, and even Marsha, I think Marsha had something to say. But I feel like TikTok or Instagram Reels have been a significant catalyst in shifting the paradigm towards how students view mental health, or how I would say Gen Z or now Gen Alpha are viewing mental health. There is an excessive amount of readily available material on mental health, which is not carefully filtered through specialists or professionals who understand context behind diagnoses, behind presenting concerns. And when like Gen Alpha or Gen Z that are exposed to so much information through influencers, that can be very detrimental to how they internalize their own presenting concerns. So let's say, for example, a student may be struggling with in academics, and then they watch a TikTok about, oh my God, these are 100% guaranteed signs of ADHD that I experienced going through school, which was I couldn't focus on my classes, couldn't do this, that, X, Y, and Z. And then now it's like a diagnosis by association where they see someone having a similar experience, and now it's my experience, which can be very confusing for a lot of young minds to navigate. And that's where professional help or context matters. So with TikTok and Instagram Reels and so much exposure to all this information, it gets really tough to sift from what's right and what's wrong.
I would say over the last, well, I've been doing this a long time. Over the last 25 years, we've certainly seen a change. Counseling centers on college campuses used to be seen as a place where students with because they were homesick or they had a relationship breakup. And that was about it. Now counseling centers on college campuses are much more like community mental health organizations. We see anything and everything that you can think of in the counseling center. And they've been more long-term in the students than they were before. They don't necessarily develop when they get here. They've been dealing with them for a longer period of time.
Yeah, I think trend-wise, and people who are in my classes are probably tired of me saying this also, but I always think about distress tolerance and just like tolerance of, well, I guess it is what it says, right? Like tolerance of distress, but your ability to, I guess, whether it's sit in nothingness or to process emotions without immediately looking for something to numb. And numbing is increasingly more available than it ever was before. So when I talk about numbing, like I think that the go-tos that we kind of naturally think about is like how people numb with drugs or alcohol when they're experiencing a difficult emotion, or even like chronic shopping or like binge eating. But now when we think about like the fact that we have computers at our fingertips at all times, that too, like mindlessly scrolling or mindlessly binging Netflix is also a way of numbing or avoiding difficult emotions. And I think something we notice in something that's interesting, we're going to be adopting a software or a service to campus called Timely Care, which allows students to access on-demand counseling services like crisis services beyond just like the 988 line, and who can like schedule telehealth appointments. But what colleges have noted is that the number one service they see students making use of is the Talk Now. And so for me, this kind of goes back to this like difficulty managing difficult emotions in the moment, really needing like immediate support for that. And it's nice that we're able to offer that. And we know that those things aren't always going to be available. So how do we increase students' abilities to cope themselves?
That's such a good point. Well, and it makes me wonder too, I was listening to a podcast, I don't remember, a while ago. I listened to too many, so I can't figure out where I heard it from. But when we were doing, I know as part of the Office of Teaching and Learning, we were doing a book club looking at suicide and mental health on campuses. And when I was listening to, I remember this podcast, they were talking about just accessibility on campus and what, I think on-demand type services are becoming more common, I think, for college counseling centers. But one of the things I wanted to ask all of you is from your different, I know we have NDSU here, we have Concordia, we've had people who worked at MSU, but just what is the like accessibility, like if a person wants counseling services and say, I think there's a couple different scenarios I think of it, you're just kind of person who wants to come in and maybe talk about some feelings of anxiety. And then, are there services that you don't provide or ones that you immediately maybe turn over to? Like I know NDSU, we talk about, active addiction, active eating disorder. A lot of times we have them go to the community for higher levels of care. But I kind of just wanted to float that out and see kind of what your accessibility is at your location.
I know MSUM, it was similar. When I was there, I'm dual licensed, so I would field a lot of the substance use or families of people with substance use, but anything above like a low intensity once a week type visit would have to go out into the community. One of the big things that would be referred out would be trauma. So if anybody had complex trauma and needed like EMDR or other very specific trauma treatments, we would tend to refer to rape and abuse crisis center or something else similar for that.
I think we're fairly similar. I catch up. I was going to say we're fairly similar. We try to handle everything in-house that we can because students are paying their tuition and as part our services are part of their tuition. Like Jody said, serious eating disorders and serious substance use disorders are the most common things that we refer off. We do have some people who do EMDR, so we don't have to refer that off. We try to keep the trauma in-house if we can.
Ours is very similar at Concordia. Free services for students like the other colleges. And I think what people don't realize, or at least students especially don't realize coming in, we talk a lot about students saying like, well, like eventually I want to see a real counselor, but like this will do for now. And our own egos aside, it's helpful to emphasize to students like these are licensed master's level counselors and interns as well, but licensed master's level counselors who are pursuing licensure that would allow them to work at any private practice. It's just for whatever reason, this is their chosen demographic. And so letting students know that that's probably one of the only times in your life that you'll get access to free mental health services in that way. So Concordia is very similar in terms of when we refer out, but we don't have any sort of wait list. For reference, we have a small campus. It's about 1,600 students, 2 full-time counselors. We have our full days and lulls in the semester and whatever else, but I would say we're on par with the other schools in terms of when we refer out.
I always think that one of the struggles with accessibility is I remember them talking about this in this podcast, right? Like you want to be able to provide services to people who need them right away. And then the people sometimes who have some of the most severe issues, like let's say an active eating disorder or something like that, it's like, well, we don't maybe have the medical services or things like that. So we refer. And at the same time, knowing the community is such a struggle in terms of like, can you get in? And then accessibility in terms of, do you have insurance? It can really be a difficult thing. I remember talking to my supervisor who had worked at NDSU before. She would talk a lot about like, can we provide some type of like coping support, things like that, but not necessarily look at the active. So they get something, the active issue that's going on, which is such a delicate dance though. One of the other questions, Maddie, you had talked about this a little bit more in terms of distress tolerance, but one of the questions I had too is what if you were to think about kind of the generation, and I know college students, it runs the gamut of different generations, but a lot of times we're seeing the approaching, I think alpha generation is maybe what we're on. But what do you think would help the mental health of students, college students these days? What could we do to maybe help them?
I think continuing to normalize mental health and reaching out for services is huge, and doing what we can to help people stop using social media to diagnose themselves. I know that was kind of brought up before, but that's a huge thing. And people are like, oh, I have this diagnosis, but they've never seen a professional. So finding a way to normalize having a diagnosis, but also normalize going to a professional and getting an actual diagnosis rather than assuming because something is similar on TikTok that you have the same thing.
Something we talk about here a lot too, and it made me think about another question, which I'm sure we'll get to, just in terms of like, how can faculty and staff at large help with student mental health? But something we talk about a lot here is the fact that a majority of the campus will never step foot into a counselor's office. Like a majority of students at Concordia, NDSU, MSU State, a majority of them are not going to utilize counseling services. And so how do we as campuses build in opportunities to enhance student mental health, I think is important. When I think about like, whether it's in a classroom setting or in a club or activity setting as well, I think it has to do with the normalization piece, like Marcia said, with the caveat of making sure it's accurate information that's getting out. And not that I think classrooms are the sources of misinformation by any means, but opening up conversations about mental health, whether it's talking even about basic skills, thinking about sleep hygiene, how we're getting good sleep, thinking about, I don't know, just practicing general well-being habits. I think for the general population who's not going to step into a counselor's office, getting that information from people that they trust, that they are face-to-face with more frequently, can be a helpful way to start conversations.
I would echo what people have said. I would add my general answer to this question usually is think what grandma would have taught you to do with your life. Eat healthy, exercise, get enough sleep, have positive relationships in your life, and learn good coping skills that will help you deal with the stressors that come up with life. If you can do that, you can help alleviate a lot of the stuff that's going on. You can't change trauma and those things, but you can alleviate the reactions to it. And then I would agree, well, I would say lower your screen time as much as you can. I'll get in my soapbox for just a minute because I do a lot of ADHD assessment. And just like Austin was talking about, people come in thinking they have ADHD. And if you ask the question, how much screen time do you have a day? I get answers anywhere from 2 to 12. And people spending 3 or 4 or 5 hours a day on TikTok or Instagram, you're basically training your brain not to focus and concentrate because you switch focus every 30 or 40 seconds. So if you go to the gym and lift weights for an hour, you're building up your muscles. When you're on TikTok or Instagram, you're doing the exact opposite of what you want. So that's my little soapbox with people.
I love that
Okay.
though. Sorry, Riley, you go ahead.
Oh, yeah, no, I just want to echo again what everyone said, because like going off Bill's point and everyone else's, like a good chunk of my clients that have come in at the University Counseling Center, it's stuff that kind of ties to like sleep disturbances, lack of sleep, quality of sleep. And a big fix for a lot of people has been just decreasing your use of technology before bed. I tell them always 30 minutes before bed, no blue light, no screens, no TV. I know, which stinks for a lot of them, and using your phones. But just like that small change I've noticed with some of my clients in the time I've been there have seen some improvements within their sleep, which affects so many other things.
I think what's cool about that too, and I'm similar with the phones and the screen time, and I'll have a lot of students, which I'm sure we all do, who are like, meditation, mindfulness does not work for me. And my answer to them is always like, the fact that you have such a strong negative reaction to it is probably a sign that we have to practice it more. Like there isn't, or maybe there is, and I would love to find them. But in my knowledge, there isn't anyone who's like, oh, I would love to just sit in silence for hours and hours, unless you're my dad, maybe. But like a lot of people are not wired that way, or it's not a natural inclination to just sit and be mindful. It is 100% a practice. And so even encouraging students, so there are some students who are like, I have to have something on at all times. So like it would be really hard for me to get in the shower without something on. It would be really hard for me to walk to class or to drive somewhere without something on. And sometimes it starts as that initial challenge, like, okay, like today I'm gonna have you practice walking to class with no music on. It is, on this other hand, like the more you tell people to do things, the more you probably have to change your own behavior too. And so if anything, the more that everyone here tells students to spend less time on their screens, the more likely it is that you will also spend less time on your screen. So at least do it very selfishly.
I think along with that, one of the things and I don't know if this is generational or just, what sort of has happened over time with social media with all of us, because I could put myself in the same boat. But it's interesting how, I feel like, and maybe this isn't, but it's like if you have like if you feel kind of down or you feel kind of anxious, it sort of raises alarm bells, whereas maybe in the past it was just, yeah. I remember my mom telling me when I was a little girl and I was really nervous about something. She's like, "Yeah, we all get like that sometimes. It's all right. Like it'll come and then it'll go, And I was like, "Oh yeah, yeah, it kind of does." And but I do think that it's like maybe this is the distress tolerance piece you were talking about too, Maddie, but there's, if somebody feels a little bit down, it's more, I think there's more panic around that feeling rather than being like, everybody does feel, I mean, of course, if it's a disorder, it's a thing, but we all do feel anxious from time to time, and it's very valid, and we all certainly feel like down from time to time for, a couple days maybe, and then it sort of naturally lifts. But I think or we all feel unfocused from time to time. And so maybe with the social media, there is a jump very quickly to diagnose, and sometimes that's very appropriate, and sometimes it's kind of a phase that we kind of enter into and can enter out of too, if we don't latch onto it sometimes, right? It's all, not always, of course, but
I think part of the antidote to that piece too is having more authentic conversations about mental health. And it feels funny to say because we've never talked about mental health more. And the number of students who I think would identify themselves as being pretty open about their mental health, there are a number of things I'm like, I actually think a lot of this could be mitigated if you were honest with your friend about like, I just really don't like to go to parties, or whatever it might be. But having more authentic conversations about mental health, my brain is kind of oriented to go back to the Four Agreements, which is a book that I really enjoy, and I'm forgetting who it's by now. But one of the couple of the main tenets are, don't assume. And so getting into the practice of practicing more like assertive and appropriate communication to say like, hey, like it seemed like you were frustrated at dinner. My brain made that about me, like something that I've done wrong. I'm just hoping you can clarify or like we can fact check. But just having more honest and vulnerable conversations not only gives an opportunity to challenge the unhelpful thoughts that come in, but also helps to normalize those conversations and normalize just discussion about mental health in general.
thanks for if you look into the chat, Austin has by Don Miguel Ruiz. Thanks. I knew you'd be on that. Austin, you're always on the resources. We touched on this a little bit, but is there, I know we have a number of people from, just looking at our participant list from different backgrounds who work in different capacities on campus. Is there advice that you would maybe give people who are working with college students?
What was it? Just some general advice I would give is just learn the basic signs of like, even just like depression and anxiety, that isolating, that kind of like more nervous than usual, or just something you would notice that'd be atypical for someone around that age working in that capacity. And then also embrace the uncomfortable feeling of maybe starting that conversation with the client and be like, hey, or with that student to be like, hey, I noticed that seems like you're struggling a little bit. And if you ever need someone to talk to, I can do as much as I can as your professor, but professionally speaking, here are some resources. Just starting that conversation.
I'll piggyback on what Riley said. If you haven't had a chance to, and you get the opportunity, take mental health first aid training when it's offered, because it will help you learn all of those things, and it'll help you learn how to make referrals on campus, off campus, wherever it's needed. And then when I do that training, one of the things I tell faculty and staff members is, if you talk to a student about their mental health, if you refer them to the counseling center or to student health, don't make that the last time you ask them about that, because then they'll think you just want to get rid of them. Check back with them in a week or two and say, how are you feeling? Did you get over to the counseling center or whatever? So they have an option to talk about it again if they want.
Thinking about that question and based on what you said, Bill, I'm wondering if I know there are a lot of faculty who are very interested and motivated in reaching out to students and helping them regarding their mental health and mental wellness, but I'm wondering if there are some faculty that may not have been exposed or due to cultural differences would not view mental health in the same way that faculty that are from the US or that grow up in more Western culture would view counseling. So I'm wondering if there are faculty that are non-American, how do they view or how do they communicate to their students about mental health and factor that in? I was just thinking about that.
That's a good question. I think that it does happen. We get called a lot. I consult a lot with faculty members, and I consult a lot with people who are international before they came. So they know to ask questions. They research before they do things. And so I think that's a good step for people. But I think you're right. There are cultures who don't recognize the mental health, and that makes it harder for students who go to those faculty members. That's why I really refer faculty and staff to go to mental health first aid, because that'll help them. It'll lower their concerns about interacting.
I would also say to maybe be cautious sometimes when referring or bringing people over to counseling. I can think of several occasions where a student started crying at the end of class talking to a professor, mostly because they were anxious to talk to the professor. And the professor's initial response was to make the student walk over to counseling services with them and immediately get them in for like a crisis session. And the student was like, I'm fine. I just hate talking to people in power and it made me anxious. And they started crying and they were like mortified that they had been walked over. So I'm not saying dismiss anybody who's upset or crying by any means, but don't have your immediate response be like, and I'm going to walk you over to counseling because you shouldn't be crying, because sometimes people just cry.
I appreciate that you said that, Marcia, because that's something that comes up here quite a bit. I think we underestimate, like, counselors have wonderful skills, and I'm biased, obviously. But again, so few students are ever going to meet me. And so few students at NDSU are even going to meet Bill or Austin or Riley. Students are interacting with their professors every single day. So it is such an honor when students do come forward. And if there is a real mental health concern, it is a real honor when students do choose you to share how they're feeling in these really vulnerable parts. And so it can oftentimes be like a conversation ender when immediately it's like, whoa, like that's not supposed to be for me. Like, go talk to your doctor, go talk to a counselor. We want to be aware of resources and refer people when it's appropriate, but holding that space and managing the moment for that student is something that anyone here, I fully trust, who has an interest in helping students and an ability to empathize and hold meaningful conversation with someone, you are more than capable of. And I think that's often, it's like, well, it's not my wheelhouse. But I mean, any of the counselors here can attest that part of our first class is like learning the basic conversation and empathy skills that you're like, oh, wait, like I was already doing this.
I want to tack on to what Maddie said, because we have psychiatric residents who come in and do 4 hours a week at the counseling center. And when that program came and asked us to, what they wanted us to train them was how to have real conversations with their patients, a face-to-face conversation, and not be so medically oriented. So that's what we're training them in. So Maddie's right on there. Anybody can do that. You just have to have that face-to-face personal conversation.
And it is, I feel like too, in the age of social media, that can really go a long way. I think for students just to have, I think, I don't know this, but I think some students are expecting their professors to sort of just go on their normal everyday, but just to see like, I mean, we do care, we really and want to reach out to students and certainly want to support them in any way that they need. And so I think that certainly can go a long way.
Thinking about what you just said, Dr. Tang, in addition to finding ways to support students, I'm wondering what are some ways that faculty can be supported by counselors when it comes to handling student concerns or student mental health concerns, where if it's a very novel experience for certain faculty members of dealing with students, or if you have a 300 student class and then you have a large number of students, maybe even 20 students that come to you with those concerns, how do we ensure that the faculty is like able to deal with those issues, navigate those issues without taking on so much of that student stress or that student concern, and have to wonder about where do I go with this? And part of it that I thought of, or based on what Bill and Maddie had said earlier, was learning the art of dialogue, and how the power of words is so magical that meaning can impact how you internalize things and how the person in front of you internalize things. And being international, I come from a culture where communication is very low context, and what that basically means is I don't have to be very literal when I communicate how I'm feeling or what my needs are. The person in front of me would understand it. But in America, communication is very high context, where everything is literal. Your words have so much weight and carry so much meaning. So with faculty and student interactions, when it comes to mental health, I think it all boils down to, can be trained faculty in how they talk about mental health, so they don't take so much of that pain with them. And same for students, where if students come from low context cultures, if they see the faculty also like stressing out or getting anxious when their student tells them about, this is what I've been struggling with, how to assimilate that information and convey that you're in a safe space, we'll connect you to the right person, and I appreciate that you reached out to me. So something like that.
That's such a good question, Austin, of like because I kind of walk in this funky dual role where I'm seeing clients and I'm teaching at the same time. Although my teaching isn't, I mean, because I'm teaching counseling students, so it's a little bit different. But I do, like when I've talked to faculty, and I know in the last group, that book group that we did, I know faculty were talking a little bit about the struggle between wanting to support students in their mental health and also feeling a sense of like sort of a struggle to hold the standards, right? So if and I sense this, like I think as an instructor too, it's like you want to give students all the grace in the world, right? When they struggle with anxiety, depression, so forth. And at the same time, I mean, even as a counselor, we know sometimes giving somebody that grace can be important, and sometimes it's actually detrimental, right? Like if you have somebody who's anxious and you tell them they don't have to do anything, in some ways you're reinforcing the anxiety, right? So it's a really fine balance of figuring out like, how do I support a student who's having this mental health crisis, or support a student who's anxious or depressed or has trauma or so forth. And at the same time, how do I help that student feel more confident and kind of move beyond that, which I think for faculty, especially if you don't have the training behind that, is really difficult well, it's difficult for a counselor, right? To like determine, when do I push on the gas pedal and when do I push on the brake a little bit, So that's a good question, Austin.
Jody, Blake had a question about whether the NDSU Counseling Center had the skills to help veterans in the counseling center and their families. Now, my answer would be yes, we have the skills to help veterans. I think the general anxiety, depression, those kind of things. We do have people trained in trauma, so they can help with that side. We would not be able to serve the families because we only serve registered NDSU students. So that would be the answer to your question. Right?
And I know the families, I mean, depending on what they're coming in with, could be, sir, I'm kind of kicking it over to you, Riley. Community counseling services takes with is university based. It's where our practicum students work, but they will take individuals from the community. So could serve the family on a sliding fee scale, depending on, we screen, well, I shouldn't say we, Riley and the team screens people when they come in, just because our prac students are working in the clinic. And so we try to ensure that the cases aren't too severe, too over their heads. I mean, Riley, you can speak to that better than I can.
Thank you, Dr. Tang. And yeah, we do take community members and we do work with families. But like Dr. Tangen said, we are limited in that these are like, the way I put it to people that aren't as like familiar with counseling is I say that these are baby counselors. They are good at absorbing all sorts of information. They can help out with a lot of the basic stuff. But if someone's coming in with like deep military trauma, that's something where we would have to refer out. But we are willing to help out with like family stuff, with like communication, coping skills, all that stuff. And if a NDSU student is a veteran, we do offer a veterans group that meets once a week, I believe on Tuesdays. Don't quote me on that though. I think we also do take community members. I'd have to verify that just because I don't work with the group too much myself. So yeah.
Great, thank you. I know we have about, I think, like 10 minutes left, a little bit more than that. Do other people have questions for our panel members? Blake has a question.
No, thank you.
Yeah.
Sorry I showed up late here, but I appreciate you folks having this panel today. So I'm brand new here at NDSU. I'm a new program coordinator. I work with Jim Stoddard. So I'm trying to get involved as much of this stuff as possible. So one reason why I mentioned family members, veterans, is a lot of veterans are handing over their GI Bill educational benefits to their children or spouses. So obviously the veteran brings the garbage home from the war zone and it affects the family. So they would be members, they would be students in DSU, but maybe they're dealing with, wartime issues with their veteran. And then could Mr. Riley send me the information on that veteran support group? Because I haven't heard of that yet. And I'll make sure that Jim knows about it. Maybe Jim knows about it, but I'll make sure he knows about it. And then if we haven't been able to pass that around, we'll make sure all the veterans are aware of it. Could the family members of veterans join that group?
I am not entirely sure off the top of my head, unfortunately, but I can confirm, what is it, at the end of this meeting here, our host can send me your email and I can post her and my phone number so we can have a chit chat about it and make sure you got everything you need.
Awesome, thank you.
My pleasure.
That's all I have at the moment.
Thank you, Blake. Other questions that people have? Okay. Well, one of the last questions that I have on here, which is kind of maybe sort of an odd question, but I'm curious, for those of you who are working in this capacity, like if you had a bunch of money, what would you do? Like health. I think that's often seen as a barrier. So that's why I asked that.
I would put a lot of money into like stuff like having those psychiatric people on campus that we have already, maybe having more people that are like full-time, kind of like just so students have access to it, but also kind of be like, for some students, like that nice like first encounter for a lot of them with that kind of practitioner. Maybe even setting aside some sort of like account or fund for students that maybe have trouble or have financial concerns accessing mental health services. So like if it's something that's beyond scope of practice on clinic, we can still find a way to like hook them up with services off campus. And I know we do have a case manager that's pretty great at like getting us loads of services for our students who need it. But I think that also just having that extra funding there just to make sure our students are performing at their best and living, well, their best lives would be great.
Yeah, I agree.
I mentioned previously that Concordia has invested for next year. It's official that we'll have timely care. And so that allows students to access, whether it be off-campus mental health resources without using any amount of insurance. So especially our international students, that's a helpful service. And I'm grateful that the college saw that as a worthy investment. I think similar to Riley's point, where I always struggle with students or wish I had more resources at my disposal has to do with like med management and psychiatry. That being said, I think the other thing, and this goes to Bill's point earlier, but like making sure students just have their basic needs met. So making sure people are clothed, fed, live in safe housing. All of those things go a really long way. So thinking about how our college can continue to support, for us, I see it especially in our international student community, where we do have a food pantry available to students, and we do have like different clothing drives to make sure students can have like warm gear for the winter. When you think about all those students traveling and who are unfortunately so unprepared for the winter, because how could you not be? Like, making sure students' basic needs are met and investing in that, I think, is a big thing that could always use improvement.
Jody, I think your written question said billions of dollars.
That's right. You have billions of dollars.
I would hire new staff. I would hire more staff because we could use more staff to do the services, but also if you have more staff, you can go out and consult more. You can do more presentations and outreach on campus, and money for professional development for staff members so that they keep up on things. But if I had millions of dollars, even billions of dollars, I would help students fund their tuition, because one of the biggest stressors that we know for students, especially at NDSU, we know, and I think I know at M State for sure too, is students have to work to be able to afford to go to school. And
Mhm.
working 20 or 30 hours a week makes it really hard to function well in an academic situation.
Absolutely. Yeah.
I would echo all of that, but kind of piggyback on Bill's hiring more staff. Like, we have staff that works in the evenings. So when students aren't in classes, so there's more availability for students to get in. Or maybe even staff that's available on weekends where they could set up at different events or be more visible that way, but also be more present in outer campus, so it's not intimidating to go in.
Yeah, that's
Christine's suggestion in the chat to have the services have a service available to faculty and staff too is a good idea if you had millions of dollars.
yeah.
And we will keep offering mental health first aid and other trainings. We actually have 2 new trainers just doing their first session in April, so we'll be able to offer more trainings.
Oh, that's wonderful. Yeah, it's interesting, we're doing interviews for the College of Health and Human Sciences, the new dean coming in, and one of them had talked about at their university, they actually have one of the counseling faculty help a lot of the faculty and staff, which I thought was interesting. I don't think not necessarily in a counseling capacity, just because of dual relationships, but just to kind of support and provide some more support to faculty and staff, I think is good.
Well, I can tell you historically that was done more often, but as mental health stuff has gotten more serious, it's gone away across the country.
Yeah. Yeah. Very understandable. Well, any last thoughts from any participants or panel participants?
I just appreciate participants being here as a current student, former student, and it's important, like, I think for students to know that their professors or other staff members are having these conversations in and of itself can make students feel really heard. Professors and staff members who show support to students absolutely are referenced in our offices, always. And it's always something that we ask about too, like, who are your other supports, even if it is your tutor that you see every single Tuesday. Those things don't go unnoticed, and so I appreciate people taking time out of their busy schedules to come.
Absolutely, I agree. Well, thank you so much for those of you who came, and thank you for panel members for coming in and sharing your expertise and knowledge. I very much appreciate it.